will land up to the cancer cells. As you know, the cancer cell are like 30, 32, 35. They have gone for hysterectomy, which is very common. They have a habit of washing the vagina with the water. pH should be matching with the vagina pH. At the cervix of the female kills the sperm over there only. You know, the most common reason for the vaginal infections are.
Thank you so much for giving your time today.
Thank you. And you know what? The last video which you had sent me, the patient of mine who had seen that video, they was very happy.
Moving forward, today I want to discuss vaginal discharge, what it means for a woman, because there are multiple types of discharges. Some are good, some are normal, some are not normal. And also I want to tie it to infertility, whether vaginal discharge affects fertility or not. But first thing first, let's lay down the foundation of our private part. So from my understanding, we've got vulva, we've got the vaginal opening, we have got the urethral opening. When we talk about cleaning the vagina, a lot of people are confused because vagina in itself is the opening, but a lot of people think it's the vulva. So kindly elaborate on this for us.
Yes, of course. First of all, I would like to explain about the vaginal discharge. Discharge from the vagina is actually a normal process. It is not an abnormal process. But there are certain colors and things are associated with the discharge. Then we will consider it as a disease or as an infection. The vaginal discharge is usually, healthy vaginal discharge is usually a clear white or off-white color without any odor or smell. This is the normal vaginal discharge. And you know the quantity of it should be 1.5 to 2 tablespoons.
How do we measure it? Because we cannot take a spoon and measure it. So.
Yes, of course. If you pour 1 tablespoon of water on your panty, you'll observe that how much discharge. In the whole 24 hours, the female will get a 1.5 to 2 tablespoon of discharge, which should be clear white color or off-white color. And it should not be with the odor. Smell should not come in the discharge. And it should be not associated with itching or pain in the lower abdomen. Such symptoms should not be there. Then only it can be considered as a normal vaginal discharge. If there will be a mixed color like yellowish, whitish, yellowish, grayish, reddish, brownish, such kind of discharges are there, or curdy. Sometimes the white color, but it is like a curdy kind of discharge. It indicates about the candidiasis infection. So such type of curdy white or such abnormal color, then only it can be considered as an abnormal discharge. First of all, before starting the vaginal discharge, I have to differentiate that it is a normal process. As you say, the vagina is an orifice, it is an opening. Whatever the bacteria or pathogens are there, the vagina used to expel it out. So in the reaction of that, it gives out the discharges. So there are certain conditions in which the discharges used to come. Like, see, if you will observe the pattern of discharge during the ovulation, when the eggs will release, at that time that is a normal natural vaginal discharge, so that the sperm can swim up to the uterus and get the fertile the eggs. This is like a natural phenomena of a body, and there are many of the females are using birth control pills that also give a vaginal discharge. So there are certain conditions in which the vaginal discharge comes naturally, which is not infectious.
Okay, so if I were to sum it up, vaginal discharge is normal till the time the discharge is clear or off-white in color and it doesn't have any. Now, the moment it becomes grayish or greenish or reddish or yellowish, or it's got like a curd-like texture, that's when it's an infection. The reason why doctors are asking the patients not to use vaginal wash or any douching method is because
it will change the pH of vagina, which will create much more problem for her. So we should not change the pH of vagina. See, the normal pH of vagina is between 3.8 to 4.5, which is mild, moderately acidic. So by dousing and by cleaning so many times with the water or soap water or many things, it changes the pH. So because of that, the patient will be more prone towards the infection.
Yes.
So we say that we should not change the pH. We
Okay.
should not use so many fancy items.
Now that's vagina. But can we use all these feminine hygiene wash in the vulva area?
No, we can use the female vaginal wash, but we should always remember the pH. The pH should be matching with the vagina pH. Before purchasing any of the vaginal wash, we should always check the pH.
Based on that, what are the best practices of maintaining good vaginal hygiene?
So the very first thing, this is a very good question you asked me because this is going to help everyone.
Yes.
First of all, always select a cotton panties. Rather than any of the synthetic fiber, always select a cotton panties first thing. Second thing, skip those fragrance and so many douches, detergent wash or any kind of fancy washes and all for vagina. It is not at all required. Okay. And the third is, see, in my practice, many of the patient comes with the vaginal infection. And the most common reason for the vaginal infections are they have a habit of washing the vagina on and off after passing the urine with the water.
Oh, okay.
And they not wipe it. They just wear the panty because of the moistness, because of the sweat area over there. All the times the panty will be very, wet. Wet, and because of that, in such condition, it is more prone towards infection. So they are washing to prevent themselves from infection, but they are inviting the infection. What they have to do after passing urine, with the tissue roll are very common nowadays in a washroom. So they can take a tissue roll and they can just with a dry tissue roll, they can just wipe it from, and there is a direction also. Always wipe the vagina from front to back, not from back to front. Okay, from back to front, because the back side there is an anal canal. So you're bringing the infection of anal canal towards the vagina. So this is the direction for wiping. And yes, one very common question are that nowadays there is wheat and waxing, Brazilian waxing, such of fancy waxings are coming to clean the pubic hair. So rather than using all those, we doctors always advise to trim the pubic hair rather than clean shave. If they'll not trim, they'll just use any of the harsh chemicals at the pubic region. This will also create many problems and invite many infections. And yes, always stay hydrated. Females have a habit of drinking less water. So always stay hydrated. A good habit of drinking good water will be always good for the pH of vagina. And if the pH of vagina will be healthy, then the infection will be not invited. And one more thing, those females who are more prone towards the infection, we always say that use condoms. Use condoms for intercourses. Rather, see, condoms are not only the contraception. Condoms have a role in these cases also, because if a female will have a sexual intercourse with their partner, definitely the infections from their partner will pass on to them. And as I said, do not change the pH of the vagina. Whatever this vaginal wash you are using, you should be matched to your vagina pH. And these all things, measures you can do for a good practice of keeping your vagina healthy.
The intake of water has a direct relation to the pH of our vagina.
Yes, it have a role.
Okay, you touched upon this briefly. However, walk us through what vaginal discharge is like during a woman's menstruation cycle.
Many of the females are telling me that when they get the menses, they get a discharge, and that is normal.
Yes.
Before starting the menses, the discharge can come. It is a plug of mucus which come from the cervix. And after menstruation also, they can have little bit of sticky discharge. Sticky discharge, which is nothing but the debris of endometrial tissue. This is also normal. During her mid-cycle, then also they'll be having a little bit of discharge, which is indicating the ovulation.
Let me rephrase that. In an entire cycle of a woman's menstruation period, right before she gets her period, she gets white liquidy discharge. And after her period is over, she will get sticky whitish discharge, which means that her endometrium lining is breaking down and is getting secreted. And then around the time of her ovulation, which is around the 12th, 14th, 15th day, is the day when stretchy egg white type mucus will get discharged, which is a good indicator that ovulation is happening.
Yes.
Beyond this, anything which is greenish, yellowish, reddish, brownish, stinking, all these are a problem.
Yeah, these all discharges are abnormal. Sometimes a patient is pregnant, like what we see in our practice, the female is pregnant and her menses are overdue. For example, she got a menses in previous month of 5, and this month it was 10, and she do not get till now she do not get menses, and suddenly she get a discharges which will be brownish or reddish, and she think it that this is a discharge, but it is not a period. That discharge will indicate that either the baby is implanting is a weak implantation, or she is lending towards the missed abortion. Such cases are there. So the discharge is always indicating the health of the patient. So if it should not be misunderstood.
Yes.
So we'll confirm it with the certain test like beta HCG or UPT, and it is positive. And then we see the discharges in on their panty, and then we understand, oh, this is not a discharge what you are thinking. Actually, it is indicating to something else. Whatever discharge come from the vagina, if it will be apart from off-white or clear white, then definitely it is indicating toward any kind of infection or any kind of diseases.
Vaginal discharge serves as an indicator of overall vaginal health. Got it? Now, moving on then, you mentioned abnormal vaginal discharge. What are the most common causes of abnormal vaginal discharge?
See, there are bacterial causes. There are causes means in a patient language I'll explain you, but
Yes.
what are the pathogens first I'm explaining you? There are bacterial, yeast infection, gonorrhea, chlamydial, fungal. This all pathogens are involved for the abnormal vaginal discharge. And how it come? What is the source? Definitely the source is sexual intercourse. The infection spreads from the sexual intercourse. If a male partner is suffering from any of the gonorrhea or chlamydia or any kind of infection, then definitely they'll have a sexual intercourse with their partner. It will transmit it to them. So the very first source of infection is a sexual intercourse. And then the second is if a female is wearing wet panties all the time, this will leads to a fungal infection. It's not like all the times they'll have an intercourse and then only the male partner is only responsible for giving the infection. Sometimes if you will not follow the rules to keep your vagina healthy, then you yourself will invite a infection. You know what? The urine infection also give a complementary infection to vagina.
Oh man.
Yes. The urethral opening and the vaginal opening are very close to each other. So sometimes that also gives the infection. Bacterial infection is always yellow in color. Okay. And the yeast infection is always grayish in color.
Okay.
This one, the disturbed uterine bleeding pattern or irregular menstrual always give a discharge of brownish either or reddish. This is a disturbed uterine bleeding, or we can say is as a irregular menstrual. If the person is suffering from menstrual irregularity, they'll have such kind of discharges.
That is such great knowledge. Thank you for that. Beyond all these fungal infection, I wanted to ask you, when it comes to STI, chlamydia, gonorrhea, these have direct link with sub-fertility in women, correct?
Yes.
How exactly does sub-fertility get impacted? Is it like the tube is blocked or damaged?
No, it's not. The fertility will be impacted with the discharges. It's like what happened? The sperm usually deposited at the mouth of the cervix. So there they have to travel inside the uterus. The infection at the cervix of the female kills the sperm over there only and do not allow them to travel inside.
It doesn't even have a standing chance. You talked about different types of color in relation to different types of infection, the texture, the odor of vaginal discharge. And please remind me again, what is greenish discharge? What does that indicate?
Greenish discharge is always indicating towards the fungal growth or as the chlamydial or trichomoniasis, such kind of infections.
What is the third one again? What does it mean?
It's a pathogen. It's the name of the pathogen which causes such kind of discharge. In our clinic, what we used to do when a patient comes with a discharge, vaginal discharge, before diagnosing anything, we first check the pH of the patient.
Okay.
We have a pH card. We used to check the pH. If the pH varies then definitely it will be a bacterial vaginal. Will just it is an infectious discharge. And then, according to the color and smell and the complaint of a patient, we rule out which kind of infection it is. In a most common, what a mixed infection comes,
Okay.
where the bacteria and the fungi, all the infections are mixed. Nowadays, we are using many kind of drugs, vaginal suppositories, vaginal creams, and all to get cure.
The most important thing is shame stops a lot of people from getting help.
Yes.
If a woman were to notice any abnormal vaginal discharge like we have discussed today, how important is it for them to seek medical attention at the earliest?
Yes. If the vaginal discharge will be, if it is abnormal vaginal discharge and a female avoid it and get a shame and do not share with the family one and do not consult to a nearby gynecologist, the infection spread up to the uterus because cervix is the mount of the uterus. So the very first sign it gives, sign and symptoms from the cervix, that it gives a discharges which is abnormal in color, consistency, odor, itching, associated symptoms. If it is get neglected, then the infection travels up to the uterus and it spread up to the uterus and create a problem which is called as PID, that is pelvic inflammatory disease. In this, what happens, the uterus gets swollen up. Sometimes the tubes are also getting involved to create an infection of the uterus. And in such condition, the female will be getting problem to get conceive also. And there'll be so many issues. They'll be having a pain in the lower abdomen. So this all problems can occur if they avoid the discharges, abnormal discharges. Then,
if left untreated, how likely is it to cause cancer? Like, for example, cancer of the womb or cancer of the cervix?
Cancer of the cervix, if you are asking about the discharge, the journey from discharge to cancer, then I'll explain you. A journey from discharge to cancer will go in such cases like if it is associated before PID, what happened? Before PID, the cervicitis occurs. Cervicitis is nothing but the cervix. If the infection at the cervix will be so much that and untreated and unnoticed by the female and not taken a proper treatment, the cervix mount gets swollen up. And this condition is called as cervicitis. And along with cervicitis, there will be an abnormal discharge of many colors, and there will be a fishy odor along with a frothy kind of discharge will come from the vagina, and it will land up to the cervicitis. And then also, if it is left untreated, then it will create a chronic cervicitis, chronic PID, and then what happens? Any of the inflammation or abnormal growth in a cell at any particular area of our body, it will land up to the cancer cells. As you know, the cancer cell are like abnormal growth of a cell, in an abnormal way. So if that occurs at the cervix, then definitely it will be a cervical cancer. If left untreated, and the pathogens will be more strong and it will be creating a too much of inflammation and the infection will be spreading up to the lymph node level, and also gradually it can land up to the cervical cancer also.
That is so scary.
Yes, of course.
So we've talked about infection, fungal infection, bacterial infection, STI infection leading to vaginal discharges. Now I want to come to treatments.
Yes, first of all, if we'll take a history of the patient, if any of the female is using a birth control pill for a long time, then we will definitely say them to stop it. And if the patient is towards the menopause, means at after 45 age, so definitely they'll be having a estrogen level very, so we have to give a supportive treatment because of the dry vagina. They'll be having always itching. They will scratch the vagina, and what happened? Vaginitis occur, and if vaginitis occur, then there'll be an abnormal discharge. So first we will take a proper history of the patient. According to that, we will give a treatment. If it will be a mixed infection, then there are so many vaginal pastries come nowadays like Candid V6. And there are so many of the tablets are there. We used to give them. And instead of washing with the feminine wash, as you say, available in market, I being a doctor, recommend them to go for a betadine sitz bath. There is a solution, betadine. I used to give a betadine solution, and they have to put it in a lukewarm water and then sit for 10 minutes in that water. Then they have to wipe it with a soft cotton tissue roll or something. Like wipe it, and at the night time they can put a vaginal suppositories we used to give them. It will help them to reduce the infection, and definitely patients are getting cured with it. And according to the mixed infection or a pathogen involved in that, we select the antibiotics, antifungal according to the need of the patient.
So when a patient comes to you, you look at the type of discharge she has, you talk with the patient, and you rule out different types of infection. And at last, you zero in on the kind of infection that she has. A lot of patients, they decide to take antibiotics on their own without going to doctors.
No, I strictly recommend, because they don't know which pathogen is involved, either fungal or candid infections are there, or which kind of infection is involved. According to that, we will decide which antibiotic they have to. It will lead to complication, because and complication of what? They'll not get relief in the symptom only. So in such cases, like they have to consult a gynec, and rest of all we will take care of which antibiotic will be.
In short, if you have got abnormal discharge, take yourself to the doctor. Leave it up to the doctor to diagnose and to prescribe you medicine. If you're taking the wrong pill, you might not even get relief from your infection.
Yes.
2 things I learned today is washing the vagina with water after urine and not wiping leads to a lot of infection. Second, STIs, some STIs can cause sub-fertility.
Yes. And the journey from vaginal discharge to cancer.
Yes. So any advice that you want to give to our audience?
I just want to conclude this meeting with telling a very short myth in the people. We have in a market 2 kind of patient. One will be too much of alert. One kind of patients are there, those who will be having a really very ill problem, like they'll have a really serious problem and indicating like this is a very abnormal discharge, and they'll neglect finally land up to the cervical cancer. A very 2 points I'll say: all the discharge is not abnormal, all the discharge is not a cancer indicating towards the cancer. So just take care. If any of the female feel that the discharge is not normal, it is a different consistency, let the doctor decide. Do not become a doctor by themselves and deciding that I am developing some serious problem, I have to remove my uterus, which is very common in this area, that people just remove their uterus, go for hysterectomy because of discharges. They misunderstood the normal discharge also as abnormal.
And the doctors just say yes if the patient wants to remove the uterus?
They know also now. They'll go somewhere else and they do the hysterectomy.
Oh my God.
They'll go to other places to the quack kind of doctor and they'll go for hysterectomy. I tell you, this is very common. If I refuse many of the patients for hysterectomy, but they had gone to some other quack kind of doctor, planned a hysterectomy and they had gone to hysterectomy. After a few years, they'll come with me with the osteoporosis changes. Again, they'll tell the same problem, that still I'm getting a discharge. Now they have a fear that the leftover thing in my uterus, now it is creating a cancer inside my body.
It is rotting.
That's why I had explained this topic very elaborately, so that with this interview, any one of the patient will change their mind for hysterectomy. If they'll be having a normal discharge and they had planned for hysterectomy, at least they'll change their mind.
But going to quacks for an operation, that's life-threatening.
Obviously, if you see in the periphery area, at the age of 30, 32, 35, they have gone for hysterectomy, which is very common.
Really?
Yes, of course. I'm telling you the truth. They have a fear.
I'm shocked. Why would anybody choose to do that?
This all kind of thing happens in periphery.
Well, that leads me to one more question then. Perhaps, okay, lack of education is definitely one reason why they're doing that. One more concern that I have is access. In terms of not just access to doctors and hospitals, but money is also a concern. For example, I'm a daily wage earner. I might not be able to afford consultation fee also. How is our public health care equipped to handle such cases?
See, the one question now just asked that I'm a daily worker, I do not have so much of money for a consultation fees. Because of that fear also they'll go for restrictive. They comes to the gynae, and if a gynae do a proper perspective examination and see the discharge was normal, console it, and convince the patient everything is normal and this that. But still, if they have a fear, again and again, if we go and consult, we'll give a consulting fees, we'll pay for the medicines, we'll pay for the investigations. How much we'll do? Usse acha will go for hysterectomy. That will be much more better. Permanent solution. If you will open such kind of funds or any of the whatever you can give the in a periphery avoid hysterectomy, they will. This will not be avoided unless and until they have a awareness program or awareness knowledge by any of the media. In my practice, I try my best that I convince my patient that okay, first of all, patient come with the mind to go for a hysterectomy. I change their mind that okay, give me a time. If I do not treat you well, if I do not get your problems cured, then you decide. But first, give me a time of at least 14 to 15 days. So many weeks and months you wander here and there. Give me a 2 weeks. If I would have not settled it in 2 weeks, then you can do whatever you want. I have to convince them in such way, and I feel very blessed. And I got an opportunity to treat such people, those who are really, really they need a good gynec in the periphery. So I feel very blessed to set in up. I have a branch in the periphery also, and I'm very blessed because these people needs me.
Yes, they do. India needs more doctors like you who will speak up. What about the consequences after it's removed? Isn't the health impacted so badly?
So bad, so bad. At the age of 35, 38, they are suffering from osteoporosis.
Yes.
And the females in periphery, they are in a very miserable condition. They have a lack of nutrition. They have so many works to do. There are so many things in their life. They have so many family burden. And in that also, they are done the hysterectomy to get themselves cured permanently. And in that, in such condition, they are landed up in another problem.
So much of learning, Dr. Khushboo. Any advice that you want to give to our audience?
The advice which I'll give to the audience is that, see, don't get panicked with the vaginal discharge. Please and please immediately consult to a good gynecologist, which will help you to come out from this problem. Let us decide whether this vaginal discharge is normal or abnormal. Apart from this, I would like to suggest that whatever tips and tricks which I've shared with you all, please go through it and please practice it regularly. This will help you to prevent many diseases. So I feel prevention is better than cure.
Absolutely. Dr. Khushboo, you are India's cold daughter and you're just starting your journey. You will do much, much bigger things, spreading education, spreading awareness, touching a lot of people's life. I am so proud of you, even though we have never met. I cannot express how proud I am of the work you're doing.
Thank you so much.
Most welcome. And I will always pray for you.
Thank you so much. Okay, bye.
Bye, Dr. Khushboo.